So our next case is a haemorrhagic invasive pituitary macroadenoma, and this is a special case to me because this is from Dr. Mamdouh Mahfouz. Please pray for him. Dr. Mamdouh Mahfouz is a famous radiologist doctor, and he passed away 1 day ago. And all the Egyptian and Arabic radiologists are very sad for that. Okay, so let's start the case. This is coronal T1 weighted image, non-contrast. There is no contrast in the vessels. Okay, so this is coronal non-contrast T1 weighted image showing a large cellular mass with supracellular extension and compression of the optic chiasm, especially on the right side. The mass is seen invading the left cavernous sinus with complete encasement of the left carotid artery without narrowing. This is very important. The mass is seen surrounding the cavernous part of the internal carotid artery without narrowing. Why? Because the specific criteria of meningioma is to surround the internal carotid artery with narrowing of its caliber. So the differential diagnosis of this mass is meningioma of the cavernous sinus. So this is invasive macroadenoma. The invasive macroadenoma can surround the internal carotid artery without narrowing. However, the cavernous sinus meningioma, when it arises in the same region here, it can surround or encase the left. It can surround the internal carotid artery with characteristic narrowing. Okay. So there is an area of high T1 signal seen within the mass representing recent hemorrhage. However, the component of the tumor that is extending into the left cavernous sinus doesn't show hemorrhage. Okay, so the diagnosis here is hemorrhage into an invasive pituitary macroadenoma. So what are the risk factors for hemorrhage inside a pituitary macroadenoma? The first one is hypertension related to the pregnancy. The second one is postpartum hemorrhage, okay, which is called Sheehan's syndrome. So if a postpartum hemorrhage leads to pituitary apoplexy or pituitary infarction after hemorrhage inside a pituitary tumor, this is called Sheehan's syndrome. Okay. The third risk factor is bromocriptine treatment, which is a dopamine agonist. So that's all for this case. And don't forget to pray for Dr. Mamdouh Mahfouz. Thank you.